So my name is Victor Cisneros. I'm the Director for Diversity, Equity, and Inclusion and Community Health Outreach at Eisenhower Health. I'm also faculty in the emergency department, and so we're out here training the next generation of physicians when it comes to achieving health equity and really taking care of our community. And not only is important for our community that we go out and we minimize some of the barriers such as transportation, but also we train the next generation of physicians to learn to take care of patients outside the confinement of the hospital system.
I think as a doctor, it's impacted me quite a bit because I see the difficulties that people go through, and when we discharge people from the ER that don't necessarily have all the resources that some other people have, what they're going to have to go through to try to get follow-up and to get the healthcare that they need.
As we know, a lot of times patients don't have the ability to come to the emergency department or to the hospital. There's not enough clinics to take care of the community, specifically when it comes to our unhoused population, the homeless. So we're out here leading the way in terms of taking care of this patient population and addressing not just the medical needs, but as you can see we're out here addressing some of the health-related social needs that are as equally important, like food insecurity, behavioral health, addiction, medicine, and we're providing many of those resources, including medical screenings and medical health care needs. Historically, our residents have been going out there as part of their training and their curriculum to team up with volunteers in medicine and other community partners out here to provide the service that we call street medicine.
We're able to treat everybody and really come out to the people that are not willing or not able to get into the hospital or get into the clinic so that we can provide medical care for them.
Using our mobile unit instead of the traditional backpacks and carrying what we have on our backs, now we can actually offer some quality care to the patients. So we're able to do proper exams. People are able to have privacy. We're able to do basically pretty much anything that we can do in an urgent care or primary care setting. We're the only mobile unit in Riverside County that has ultrasound technology. And so that allows us to really differentiate between certain pathology and decide, does this patient really need to go to the emergency department or can they be treated in the spot? And the idea is to hopefully prevent some of these unnecessary emergency department visits and prevent patients from getting really sick and treat them where they're needed the most.
I feel proud to be a part of this whole program, not just with Eisenhower, but also with all of the resources that kind of come together as a community. I think it makes a huge difference.
I'm excited to expand upon this program and hopefully have more mobile units to come, and we can kind of be addressing some of those pockets where it's needed the most.